Good afternoon, everyone. I'm Liz Charlotte, Director of Communications at the Mississippi State Department of Health, and I thank you for joining us today. We get a lot done during these press conferences, and you know I will take all questions until they're completed, because this is for you, and it's your chance to talk to agency leadership. So before we start today, I want to say a word about our fantastic State Health Officer, Dr. Thomas Dobbs. The reason you have not seen him for the past few days is because he's actually taking care of some family business. It's actually good family business, happy family business, but he will return shortly. I wanted to also tell you regarding Dr. Dobbs' Twitter post yesterday, that is now in the hands of law enforcement, and neither I or Dr. Dobbs or any agency leadership will further comment on that. And Dr. Dobbs remains focused on the public health of our state and, of course, the COVID pandemic. Okay, let's now get to the press conference. We have a lot to go over, including pediatric cases and hospitalizations that are on the rise. And sadly, we do have an additional pediatric death to report. This will be the 6th death since the pandemic began. Well, ivermectin or the vaccine, which is proven safe and effective. Third dose vaccines now are available at county health departments throughout the state. And there's a lot more, including Pfizer's FDA approval yesterday. So let's start. We have state epidemiologist, Dr. Paul Byers, joining us. Hi, Paul. And we have Mr. Jim Craig, Senior Deputy and Director of Health Protection. So Dr. Byers, let's start with our case counts and trends.
Absolutely, Liz. And if you're okay with it, I'm going to share a couple of slides this afternoon, like we've done in the past. And as Liz indicated, we are sadly reporting out today a death in a child less than 5 years of age. This does make our 6th pediatric death that's been documented due to COVID. We have seen some overtime with the surge of the Delta variant, really since we started seeing this in mid-June and early July. We have seen some increases in the number of pediatric admissions due to COVID. And certainly we've seen increases in pediatric patients who've had to be either in the intensive care unit for treatment or have been on the ventilator. You can see with the latest report, we did have 7 children who were hospitalized and in the ICU due to COVID, and 3 that were on the ventilator. I think this highlights one of the things that we have been seeing recently as far as a trend in where we're seeing most of our cases now. And as you can see, looking at this chart, and this is data that is now available on our website, you can see an increasing proportion of the cases that are in children age 5 to 17 years. And so we're seeing more COVID in those kids now. Certainly a lot of these children are unvaccinated, and we're encouraging everybody now to make sure that your children 12 years of age and older are fully vaccinated. And with that increasing case numbers that we're seeing in these age groups, we're going to continue to see some increased hospitalizations. And unfortunately, some children who are infected with COVID will have some more severe complications and require more intensive care. Although, again, the vast majority of children do recover. When we look at where we're heading with overall hospitalizations and ICU admissions and ventilator use in Mississippi, guys, it's still bad. You know, we're still seeing a lot of patients that are in the hospital at any one particular time due to COVID. We're still seeing high numbers of individuals who are in the intensive care units. We're still seeing high numbers of individuals who are on the ventilator. Now, again, we are seeing some flattening out of these numbers, and certainly that's encouraging. But this is still an enormous amount of pressure that's on the hospital systems. And so we do encourage everybody who's eligible to continue to get vaccinated. And more importantly, if you do become infected, please talk to your doctor about monoclonal antibodies. We know that monoclonal antibodies, if given early in the course of illness after infection, can reduce significantly the risk of developing severe complications and reduce the risk of hospitalization. And now we do have the availability. If you call our COVID hotline at the Department of Health, there is an option to get information about monoclonal antibodies, to not only get information about the use of those, but also to identify some resources in areas where you can get monoclonal antibodies in your area where you live. And so we encourage people, see their doctor, call our hotline, get that information. Don't wait if you're infected. Do get the appropriate treatment with monoclonals. This can be life-saving medication, and this can help reduce the impact on our healthcare systems and keep our hospitals functioning. So we encourage everybody to do that. We are reporting out an additional 3,385 cases and an additional 22 deaths today. As we've discussed, we are still seeing a whole lot of cases, guys. I mean, when you look at our epi curve, we're seeing over 3,000 cases a day almost. And this is still a lot of cases. We are seeing some what looks like in some improvement in the number of cases that we're reporting out every day. But, even today, we reported out over 3,000 cases in a single report. And that's still a lot of transmission that's occurring. We're still seeing a lot of cases that are occurring in the state, even with what looks like some potential plateaus. So we are nowhere near out of this yet. We're still seeing a lot of impact from this. And we're seeing that in deaths too. Yesterday, we reported out 111 deaths. That was the highest one-day total of reported deaths that we've had during this pandemic. Previously, it was back in January, and I believe we had 98 deaths reported at that time. So that gives us, 133 deaths over just a 2-day period that we're reporting out. When we look at these deaths, we are seeing a number of deaths in younger individuals, in individuals in their 40s, in their 30s, and in some cases in their 20s. And these are individuals that are unvaccinated. We are still seeing a number of deaths over the age of 65. About 50% of the deaths we've reported over the last 2 days have been in individuals over the age of 65. And when you look at the vaccination status of those folks, they're largely unvaccinated. About 87% of them are not vaccinated. And so we've done a good job with vaccinating our folks over the age of 65. We have over 70% of them fully vaccinated, but we've still got some weak points in there. And we want to make sure that everybody over the age of 65 gets fully vaccinated. That's been one of our most vulnerable populations throughout this entire pandemic. You can see that we've had a lesser impact on our long-term care residents, but we are still seeing deaths that occur among those individuals related to outbreaks that we're seeing in long-term care settings. And so, we've still got some work to do. And when we look overall at our number of cases, hospitalizations, and deaths, without a doubt, we are still seeing the vast majority occurring in unvaccinated individuals. So we've made good progress. Last week, we gave out, as a state, we administered over 80,000 doses of vaccine. That's great. And we need to continue those trends. We've continued to see increases in the number of vaccines that we've administered on a weekly basis for the last several weeks. That includes about 53,000 folks who got their first vaccine. And that's very encouraging. We want to continue that progress. And that's going to be what's ultimately going to get us out of this. But in the meantime, there are some things that we got to focus on, and that is protecting ourselves, making sure that if we're vulnerable and we're out in public, we need to be wearing a mask in those indoor public settings, especially if you're over the age of 65, especially if you have underlying chronic medical problems that may increase your risk of severe illness if you're infected. Get vaccinated if you haven't gotten vaccinated. The FDA has now given full approval for the Pfizer vaccine for ages 16 and over. For you folks who've been on the fence about waiting for that approval, now's your opportunity to get vaccinated. So we encourage you to do that. If you've only gotten one dose of an mRNA vaccine so far, get that second dose when it's time. Don't let that lapse. Even if it's been several weeks, it's not too late. And if you're immunocompromised, get that third dose. We do have the opportunity now for people to get the third dose if you have certain immunocompromising conditions, and you can go through our vaccine scheduler that we work with the University Medical Center that's on our website. You can get an appointment for that third dose at one of our county health departments if you are immunocompromised. What we ask on that is that you self-attest, that you tell us whether or not you have one of those immunocompromising conditions, and you are then eligible to get that vaccine at a county health department. So we strongly encourage that you do that. And if you're sick, get monoclonal antibodies. Don't try to self-medicate. We've talked about that we have seen some increase calls to the Poison Control Center over livestock ivermectin use. And many of these calls have been related to the fact that people have ingested this in an attempt to either self-medicate when they've been identified with COVID, or to prevent COVID. Please don't take animal medications. These are highly toxic. They're highly concentrated. They're not meant for people. Please, if you have questions about COVID, call our hotline, see your provider. If you are positive for COVID, talk to your provider about appropriate treatment. Take only those medications that your provider prescribes. Please don't try to self-medicate with animal medications. And I do want to provide one additional piece about that. In our HON, we indicated that 70% of the calls that were related to ivermectin were related to animal ivermectin. I'm afraid that we didn't word that as well as we needed to, and people interpreted that to mean that 70% of the total calls to the Poison Control Center had been related to the use of livestock ivermectin. That's not the case. 70% of the calls related to ivermectin were related to actual use or ingestion of livestock ivermectin. And so I wanted to make sure that we were clear on that piece, that not all 70% of all of the calls that the Poison Control Center is receiving are related to animal ivermectin. But we've seen some increases, guys. Let's don't do this. Please, let's talk to your doctor. Let's get our information from your physician. Let's do this in a fashion that protects everybody. So vaccination, masking when indicated in public, and certainly get your information from your doctor and get treated with monoclonal antibodies if you're infected. And I'm actually going to turn this over now. Liz, I think that's everything that I had, and I'm going to stop my sharing, and we can go from there. Thank you.
Okay, and Dr. Byers, did you hit on the school update? I'm trying to do a million things here, and I couldn't tell if you did that.
I may not have, and you know, certainly with the school update, and we publish this information, guys, and we do get reports from schools throughout the state that report to us the number of patients that are on quarantine, the number of patients that are, or the number of students and teachers that are on quarantine that are positive, that the number of outbreaks, and we report that on our website. And you can see that in last week's data, that we did have an increase in the number of children that were on quarantine as a result of exposure. We're in a hard time, and I think the schools are doing as best they can under the circumstances. We work very closely with the schools. Many of the schools have signed up with us with opportunities to participate in testing, and we have provided testing kits and supplies to at least 34 schools and school districts in the state that are interested in participating with that. And we have about another 50 schools that are interested in having the vendor come out and provide those testing. Additionally, we have a number of schools that are participating with providers in the state, vaccination clinics, where they go directly on site and provide those vaccinations. So, we're still seeing a lot of cases in young kids, and so I anticipate that we are going to continue to see a lot of pressure on the schools.
Dr. Byers, one other question that we have been asked, and I, again, didn't hear if you talked about it. Can you explain the two different ways, again, that monoclonal antibodies can be administered?
Oh, yes, absolutely. And so certainly we can cover this, and we can answer questions as well. But, there are two different methodologies for the monoclonal antibodies. You can either get it as an IV infusion, or you can get it as 4 subcutaneous or injections into the skin, which is certainly faster. And we've encouraged providers to utilize both methods. And it's really up to the provider to determine what is the best fit for their clinic and for their patients.
Thank you, Dr. Byers. Senior Deputy Mr. Jim Craig, a lot going on in your world as well. Let's start with a hospital update.
Yeah, thank you, Liz. Our hospital space, especially our ICU space, continues to be scarce. Our COVID system of care still remains active and mandatory for all the hospitals in the state, especially around transferring patients for critical care services. It just can't be accommodated by our normal referral processes. The health officer order that was issued about the system of care remains in place and continues today, including the delay of Tier 1 and Tier 2 elective surgeries that might lead to an overnight hospital stay. In addition, MedCom reports that since the system was activated, the COVID-19 system of care for patient rotation of critical care patients, Mississippi MedCom reports that 1,307 patients have been transferred in that system requiring critical care services. We'll share just a quick chart on the hospitalizations right quick. So if we look at COVID, and this is COVID and non-COVID ICU space that's available in hospitals, as well as the beds at all different levels. As you can see, back in January, we got down in the 50, 60, and with this particular surge, as you can see, we've really, about as fast as Delta has increased in cases and hospitalizations, we've decreased in the number of ICU beds that are available. You can also notice on the right as well with the hospital bed usage, very similar, that we've seen hospital usage a little bit less, especially our ICU beds. In fact, on August 23rd was our record low of 18 reported available. And today, or actually this was yesterday data, 29 were reported as available in our ICUs. As of 8 o'clock this morning, critical care reports from Mississippi MedCom reported 15 ICU beds available, but there were 228 emergency room holds, many of those for those same beds. So it's really more of a system move around during the snapshot with 15 beds available. But of those, 63 patients are waiting on an ICU bed of the 228 that are on an emergency room hold. Of those 63 that are waiting for an ICU, 31 of those patients are COVID patients waiting on an ICU bed. We do have additional beds and ICU capacity in some hospitals in the state. It could be used, but as we said last week and for the last few weeks, the problem continues to be insufficient staffing to operate all those beds. You'll hear in a few moments, however, that there have been some efforts, and those efforts are continuing to increase ICU capacity and increase staffing for critical care of COVID patients around the state. Looking first at the federal efforts, our federal partners at the VA continue to provide 5 ICU beds at our Biloxi VA and 5 ICU beds at the Jackson VA to the COVID system of care for critical care rotation. We appreciate the efforts of the National Disaster Medical System Federal Disaster Medical Assistance Team, commonly known as a DMAT, for their assistance in hospital decompression at the University of Mississippi Medical Center. But this DMAT team has ended their mission this week and demobilized. As part of the transition, a 23-person Department of Defense medical team has arrived and is assisting with COVID patient care at the University of Mississippi Medical Center. In addition, a 7-person U.S. Public Health Service team is operating at University of Mississippi Medical Center, assisting with monoclonal antibody administration. And Samaritan's Purse continues operation in Garage C at UMMC to help with statewide transfers in the COVID system of care, as well as helping decompress overly congested hospitals around our state. The facility consists of a 32-bed unit, including 5 ICU beds that are also part of the rotation, helping relieve some of the pressure on our ICU needs. We have a 33-member National Disaster Medical Assistance, or DMAT team, at North Mississippi Medical Center in Tupelo, assisting with hospital decompression. This team is currently scheduled to complete their mission on August 26th, tomorrow. As part of the transition for that team, another Department of Defense team is on the ground at North Mississippi Medical Center with a 23-person team to assist with inpatient medical care of COVID patients beginning tomorrow. As I reported, Mississippi has received 10 2-person federal teams to assist in the administration of monoclonal antibodies. They began work last week and are in addition to the current resources, including our COVID centers of excellence around the state, in providing monoclonal antibody treatment. Yesterday, we requested an additional 8 federal teams to assist with the administration of monoclonal antibodies in the state. Our EMS services in Mississippi are stretched really thin. Their priority remains responding to 911 calls and emergency transfers, but pressures on the healthcare system have resulted in longer transfers and in some cases, longer wait times in delivering patients. Ambulance services report sufficient ambulances, but lack necessary staffing. So working with the EMS agencies of the state, yesterday we requested 90 emergency medical technicians, 27 advanced emergency medical technicians, and 142 paramedics through the federal government and the FEMA ambulance contract. We hope to have information on that request later this week. On the state front, components of Mississippi Med 3, it's one of our state field hospitals, deployed yesterday to assist St. Dominic's Hospital in Jackson. This deployment is scheduled to support the administration of monoclonal antibodies at that facility. As I said, staffing for hospitals remains a critical need around our state. Thanks to the governor and MEMA, resources are inbound, and in many areas of the state, they're being deployed to hospitals to open much needed beds and ICU spaces. We developed task orders for 61 hospitals. Those have been completed, forwarded to MEMA for resources. And this morning I signed the last of 61 deployment orders for MEMA to move those resources into place. Staff are moving to facilities today, but as a snapshot, as of 8 o'clock this morning, 11 hospitals, many being our larger referral hospitals for critical care, have received staffing assistance comprised of approximately 347 nurses, 11 nurse practitioners, and 78 respiratory technicians. Mississippi's seen an increase in requests from hospitals for ventilators, and our logistics teams at MEMA and the health department continue to deliver ventilators to requesting facilities. Our federal and state resources are working hard to address our hospital needs in this wave of the pandemic, but we're counting on the public to help turn this situation around. You know, no one wants to be put in the spot where they're forced to pick who gets a bed and who does not. No one wants to ship patients far from home or worse, out of state. Remember, the healthcare system has many demands in addition to COVID, especially for critical care. Car accidents and other trauma-related calls, these same hospitals are the destination for those critical care needs. Same thing with heart attacks and stroke patients. Many of them need these same critical care resources. I'm going to turn the share back on to go over some information on testing. I think I will anyway. Let's see. This is a map you're probably familiar with, our mobile testing site plan, where we have vendors providing testing around the state. So just a real quick rundown of the changes since the last time that we looked at this map. In Coahoma County, we're increasing from 3 half days to 3 full days. The DeSoto County Health Department, this is a new location for us, running 5 full days, doing 200 appointments a day. Forest County, we've moved to the safe room, which is on Highway 49, an increase from 120 to 300 appointments a day. Here at our farmers market, the Capital City testing location, we've seen appointments that have maxed out every day at 600 appointments a day. We have upped that to 700 appointments at that location. In Leake County Health Department, 3 half days to 5. Lincoln County, we've increased from 2 to 5 days. Lowndes County, we've added an extra hour on each of the 5 days that they're open every week. Marion County, we've increased from 3 to 5 days. And in Marshall County, from 3 to 4 days. Montgomery County, we've increased from 3 half days to 4 half days. In Newton County, from 3 half days to 5 half days. And in Noxubee, this week we have 1 full day and 4 half days. Next week we'll be at 5 half days. Panola County Health Department in Batesville, we've increased from 2 to 5 days. And Pearl River County, we've added an hour and our capacity up to 300 appointments a day. Perry County, we've increased to from 2 half days to 4. And in Rankin County, last week we moved that location to Trustmark Park. We adjusted some times, but we also this week have increased those appointments to 500 appointments per day. Stone County, we've increased from 3 to 5 days. And Tunica from 2 half days to 2 full days. And we increased from 3 half days to 4 half days in Wayne County. Winston County was a new location for us. It just opened up and we're operating there 4 half days. As of August 22nd, 3,355,357 COVID tests have been reported as administered in Mississippi. In the vaccinations, we still are doing pop-up vaccinations. These are our local short-term opportunities for vaccination for those 12 years and older. No documentation or identification is required. And we do come back a few weeks later to do the second doses. While we're in town doing the pop-up vaccinations, we always try to address any homebound needs, as well as those vaccinations that might be needed in this institutional setting or in a long-term care facility. This week on Friday and Saturday, we'll be at the Farmers Market building in DeKalb, Mississippi. Again, remember this opportunity is there for anyone 12 years of age and older. They are eligible. We will be using Pfizer and we will have Johnson & Johnson available in Kemper County for this opportunity. Our health equity unit reports a number of vaccination opportunities around the state. These are Pfizer and J&J or Pfizer and Moderna, as well as Pfizer first doses, depending on what the requesting party wanted to do. As you can see, we have a number of schools and businesses and churches and organizations that have requested these first dose appointments. And these slides will be available at the end so that you can get the list of all the locations. Here's some additional locations around the state. Again, we're seeing a lot of partnership opportunities to provide vaccine in our health equity unit through you see the acronyms up here, CHCs and CCVPs. These are our community health centers, as well as our COVID community vaccination partners. These are partners that are assisting us through agreement around the state and making sure that vaccine opportunities remain robust. A few more opportunities, again, with churches. You'll also note the International Seafarer Center. That's an ongoing process that we have for those that may arrive by ship at the ports, where they can get J&J vaccination while they're here in Mississippi. All right. Also, want to remind you that we do have free COVID vaccination available at all our county health departments during our normal days of operation. To schedule a free vaccination ahead of time, you can just go to covidvaccine.umc.edu. We're also kicking off our shots at the shop, which kicked off yesterday, where we're inviting barbershops and salons throughout Mississippi to participate in this program. It allows barbers and stylists to provide vaccine education materials and resources and host vaccination events for us. The owners or a designee will be awarded $1,000 to become a trained community health advocate. And the shop should attend a short training to learn more about COVID-19 vaccination and the role that barbershops and beauty salons have played in their communities to increase health and well-being, not just around COVID. They've been helping us for years. Also, to disseminate material about COVID-19 and the vaccine within their shops and share information with their clientele about getting the COVID-19 vaccine. In many cases, these locations will also work to schedule a vaccination event in or near their shop. If for those shops that are interested in this opportunity, they can email our program at vaccineevent@msdh.ms.gov. Remembering that the homebound, if you're a homebound and need assistance getting your COVID vaccination, please send an email to the COVID homebound at msdh.ms.gov, or they can call the hotline 7 days a week from 7 a.m. to 7 p.m. at 877-978-6453. Any businesses, organizations, cities, groups, or individuals interested in having a COVID-19 vaccination event, much as you saw a number of events that we were having with the Health Equity Unit, please let us know. We're happy to create that opportunity. You can call the Mississippi COVID hotline for more details, also at 877-978-6453. Last update, the Mississippi Legislative Black Caucus is supporting a Date to Vaccinate initiative. The Mississippi Legislative Black Caucus and the Health Department is coordinating their legislative members to host this vaccination event across the state on August the 29th, 2021. 25 sites will all host a vaccination event on the date with local community partners to help encourage vaccinations. It's supposed to be food, music, and more at these events. For more information, check out the Mississippi Legislative Black Caucus page on Facebook at the Mississippi Legislative Black Caucus at their home site. So Liz, I think that's the update that I have for today. I'm going to throw it back to you.
And I guess before we start taking questions, Dr. Byers, great news about Pfizer yesterday, right?
Yeah, I think we talked about the fact that the FDA has provided full approval for Pfizer vaccine for individuals age 16 and older, and I believe we talked about that.
Okay, well, it's hard for me to juggle in here with everything, so I want to make sure we got that out. Okay, so let's start with some questions, and let's see here. All right. Okay, this is from Janice with Local 24 News. With the latest, what is the latest with requests at DeSoto County Field Hospital? Status of 1,000 plus medical personnel announced specifically for DeSoto County. Response to virtual learning happening already. Jim, Mr. Craig?
Yeah, I can definitely start. We are still in conversations with leadership in DeSoto County, see what possibilities there are for a field hospital deployment to that location. They've kind of placed it on hold as they work some of the resources. As you can imagine, just operating a hospital, all the wraparound services you have to have for a hospital, it's about the same when you bring a field hospital to town. So we're working to make sure that we've got that deployment ready. The other thing to think about is a lot of the hospitals have some additional capacity within their facilities for beds and ICU spaces if they just have the staffing. So the real focus has been on trying to get staffing so we can keep people in hospitals and utilize those other beds to relieve some pressure from the system. As far as the status of the 1,000 folks that I think were announced, as I think I laid out a while ago, how many we've already started to deploy. DeSoto County is one of the locations receiving facilities, and they are one of the ones that are already working with their staffing agency for the placement of resources in their facility. And as far as the virtual learning, I'm not exactly sure of that question.
Okay.
Thanks, Jim. I'm not quite sure either, but we do know that a number of schools, because of, and it may be related to this, but we do know that a number of schools and school districts throughout the state, because of cases, absences from quarantine and absences from isolation, and the number of outbreaks that they have had to have a short-term dismissal, and it may be related to that, but I'm not completely familiar.
Thank you, Dr. Byers. Jackie Massey with Box 13. Will the Mississippi State Department of Health send state workers or other health workers to Baptist DeSoto or Methodist Olive Branch? Mr. Craig?
Yeah, so the current contracts are with staffing agencies, provide different levels of practitioners. I would imagine that, well, I know that both of these facilities have requested resources from the state, and we are working to make sure that they get the resources that they've requested.
Thank you. Ruthie Robinson with the Greenwood Commonwealth. In August 2020, Dr. Dobbs issued a statewide order directing all public and private schools to report their COVID data weekly. Yet some schools have never complied, including 3 private schools in our area, and some have stopped complying this year. How is the Department of Health addressing this? Is there an enforcement mechanism? Can you quantify the level of non-compliance? Well, there's a lot of questions. Do you have a breakdown of non-compliance by public versus private schools? Why does the State Department of Health want this information? Dr. Byers, I think you can address all of these, maybe one at a time.
Yeah, boy, that's a lot of questions.
A lot of questions.
And we'll try to roll through them, guys. Well, first of all, why does the Department of Health want this information? I would think that would be a little bit intuitive. This is information that helps us have an understanding of the level of impact in the school systems. And this is a good way for us to continue those conversations with schools and help provide them with some guidance as well. So, the schools, by reporting to us, they also reach out to us and ask us questions about certain situations and about how they should handle outbreaks, how they should handle cases, how they should handle quarantines within their schools, including contact tracing. And it's one of the ways that we work, but it's also a great way for us to have an idea of what is the overall level of impact in the school settings. And, there's a lot of information that the schools report to us that's useful. And we do use that, and we provide that out to the public as well for public awareness, but also provide that back to the schools. Starting at the top, we did send out that order back in 2020, and we reminded schools again of the requirement for reporting this year. We report those out on our website, and so I think it's pretty clear to see the schools that are in compliance and are reporting, and the schools that aren't. I don't have a breakdown of the names of the schools or the number of schools that are not reporting. But certainly, we attempt to work with those schools to encourage reporting, but we're not doing an enforcement at this point. We would like to have the schools, including the private schools, work with us. This is a valuable piece of information for us, and it's valuable feedback for us, but it's also an opportunity for us to work with the schools to provide those guidance. And so, we do encourage everybody to please, the school systems, report to us on a weekly basis. This is a vital way for us to get that information regarding the impact in the school settings.
Thank you, Dr. Byers. And I talked to a reporter yesterday about this. Hey, why don't you ask the school districts themselves why they're not reporting? It's a solid question.
I would encourage it, yeah.
Okay, thank you, Dr. Byers. Ross Adams, where did the pediatric death occur? Which city? So Ross, as you know, we err on the conservative side of HIPAA. And so we will only release that. I believe it's a child under 5, you said, Dr. Byers?
Yes, ma'am. It's a child under 5, but we're not going to provide any
Yeah.
additional details about that.
Yeah, that's okay. So Nick with USA Today, have you reached out to the White House about their surge teams? Are the 46 members from Army and Air Force the governor mentioned yesterday part of that? At some threshold, would you request additional FEMA or other assistance? Mr. Craig, why don't you take that? We actually did meet with the White House representative yesterday. So why don't you take that?
Sure, and White House representative reached out to us in a number of pathways, but as far as requesting resources, we have a pretty standard pathway for how that occurs. If the state can't source something, then we roll it up to our partners at HHS through FEMA and MEMA. And that's really kind of the process that we use to bring the DoD resources, Department of Defense resources that I think were mentioned. The 46 or the 23 that are University of Mississippi Medical Center assisting, and the 23 that are in North Mississippi Medical Center that will start operations on tomorrow.
Okay, thank you. Kobe Vance, have any Mississippians been held liable for violating the isolation order after testing positive for COVID-19? The answer to that is no. How is the DOH monitoring that? Well, as was mentioned just a moment ago by Dr. Byers, we are not enforcement agencies. We do check with their patients that test positive during their isolation to see how they're doing. But really, this is not something that is handled at the health department level. If someone wanted to make a complaint about someone being if they thought someone was positive and they were not isolating, that would be done at the local level with your judicial system. We do not police and we are not enforcement. Dr. Byers, do you want to add anything?
Yes, ma'am. Thank you for the opportunity to discuss this further. And this was a health officer order that we released back in 2020, and certainly we reissued it here recently just to, again, highlight the importance and the understanding for individuals who test positive for COVID of the seriousness of this infection. The fact that they are able to transmit it, especially with Delta variant, which is so highly transmissible now. One case can potentially infect 8 or 9 other individuals. And so we want to make sure that everybody is aware and understands if you're infected, please isolate. This can be a very serious infection, obviously, for a number of people. We have had over 8,000 deaths in Mississippi. We continue to have very high numbers of hospitalizations, of folks who are having to be on the vent, people in the ICU. This is a reminder that if you're infected, please isolate. Now, there are times that if we're aware that an individual is not isolating, certainly we will remind them of the importance of that. But there's nothing in this order that replaces an individual's due process to the law. And certainly, again, the importance of this to remember is that this is not a new order. The original order that we issued back in 2020 did not retire. It was still in play. And this was a reissuance of the same order that we've had before. Again, because we are in the midst of a very high surge in Delta variant with a lot of hospitalizations, a lot of deaths, and we just want to make sure that people understand the seriousness.
Yeah, so, and also I explained to a lot of reporters, this is nothing new that was instituted because of COVID. This is a long-lasting statute that's been in effect for probably about a century. And we have used it with other contagious diseases, TB, HIV. It is to protect the public. That's what drives that. It's to protect the public from contagious diseases. Mr. Craig, did you want to add anything to that?
No, I agree. There's a lot of regulatory programs that we have in public health where we have set some standards through laws from the legislature and regulations from the State Board of Health for how people should be regulated in different parts of the industry. But it's just really important that people recognize the importance of these health officer orders so that we can minimize the spread of COVID in our state.
Thank you to both of you. Let's see, CJ, you've talked about the state's hospital system in general buckling under the pressure of these hospitalizations. Specifically, how stressed are the state's pediatric healthcare services during this pandemic? And can you elaborate on efforts to expand pediatric ICU beds and services as the number of infected children continues to surge? I'll start with you, Mr. Craig.
Yeah, thank you, Liz, and a great question. You know, while we have a number of hospitals that provide pediatric services, we have a pediatric hospital here in Jackson, which is really the only pediatric dedicated facility for children in Mississippi. We have some normal referral patterns that go over to Louisiana, also into Alabama and up to Memphis to Le Bonners. But, you know, we're seeing stresses on our outlying, our partners in other states, as well as our facility here. Department of Health and Human Services, our federal partner at HHS, and the Assistant Secretary of Preparedness and Response are having conversations actually today with our pediatric center here in Mississippi to see if there are ways that we can continue to help support them better. As far as surge ICU, it's the same problem we have in the adult. It's making sure we have enough staffing. We believe we have enough beds if we just have enough staffing.
Thank you, Mr. Craig. Dr. Byers, did you want to add anything to that?
No, ma'am, I don't. I think Mr. Craig covered it. I just want to remind everybody that, and certainly one of the reasons that we're seeing this is that we are seeing a larger impact on younger folks.
Right.
A lot more cases.
Okay, let's see, Jackie Massey, can you disclose where the children who died are from? No, and I can give you the latest update on how old they are. So far, we have 3 in the 11 to, this is since the pandemic began, we have 3 in the 11 to 17 age range, 1 in the 6 to 10, and 2 under 5. Dr. Byers, check me, am I right?
Yes, ma'am, that's correct.
Okay. All right. Okay. Melissa from WDAM. Forest County Board of Supervisors have discussed a request for a field hospital set up on Forest General's property. Has that been requested from MSDH? Has that been requested from MSDH? And is there an update on the status of that? Mr. Craig.
Yeah, thank you. Yeah, thank you for that question. The Forest General Hospital has been in conversations about bringing a field hospital to their location. As an applicant, much like many other cities and counties for federal support and reimbursement, they're an applicant. I know they've been having conversations with MEMA, who assist in those grant and sub-grant programs to be able to ensure that reimbursement. I know they're having those conversations. I don't believe it's a request to us to provide a field hospital. I think they may have found a field hospital they'd like to deploy on their own property.
Okay, thank you. And Isabella, we did just talk about this. There's been talk that the 70% of calls to Mississippi's poison control for ivermectin overdoses might be an oversight, that the number has actually been lower. Dr. Byers, explain this. Write me back. Oh, did you want to say anything?
Yeah. I'm pleased to provide some further clarification as well.
Okay.
If that helps. And so the Health Alert Network message that we sent out was talking about a recent increase in the number of calls to poison control centers, the Poison Control Center in Mississippi, due to potential ivermectin ingestion or toxicity. And the intent of what we said was that 70% of the ivermectin related calls, and apologies if this was not clear, that 70% of the ivermectin related calls were actually related to ingestion of livestock ivermectin. You know, to be clear, 2% of the overall calls to the Poison Control Center have been related to ivermectin. The intent was to highlight that 70% of the ivermectin related calls were due to livestock ivermectin ingestion. And I think that's the thing that we really need to focus on with this, guys. And let's don't miss the important bits in this. And that is that people have been taking livestock medication. and it's highly dangerous and it's highly toxic, and we discourage folks from doing that.
Thank you again for that, Dr. Byers. Haley Bull with Newsy. Given the increase in pediatric COVID cases, are you seeing more missed C cases, or are there concerns that there may be an increase in missed C cases? Dr. Byers.
You know, we're watching that closely, and we're looking at the reports of MIS-C cases as they come in. You know, remember the nature of MIS-C is that it often develops weeks after the COVID infection. And so it's potential that we will see increased cases of the inflammatory syndrome in children over time. The more cases we have, certainly the more children who have severe infection, there is a potential. And we're going to watch that closely, and certainly we'll be reporting that out.
And also, Dr. Byers, Isabella Murray with the Sun Herald is asking, is it too early to say COVID numbers are slowing or plateauing? Would you say this fourth wave has peaked? I think yesterday with the governor, you talked about 2 days a trend does not make, but what are your thoughts about this?
Yeah, we'd love to be able to say that it's plateauing. I can't say that it is right now. I can tell you that you know, we've had a little bit of a slowdown in the numbers, but that doesn't mean that tomorrow we won't have an increase. We've seen some leveling in the numbers of hospitalizations, but guys, they're still very, very high. We've seen some leveling in ICU and ventilator use, but they are still through the roof. I think it's a little bit premature for us to say that that we've hit a peak. Certainly, the indicators are that we're staying with some relative stability in our numbers, but they are still very, very high.
Thank you, Dr. Byers. Emily with WTOK, is it still recommended for folks who got COVID shortly after their first dose of vaccine to wait 3 months to receive the second dose if they had the antibody infusion treatment, Dr. Byers?
So no, the thing piece is if somebody's infected, whether they've been vaccinated or not, they can go ahead and receive monoclonal antibodies without having to wait any time during that. And I think if I understand the question correctly, that's what they're asking is if they've been vaccinated, do they have to wait 3 months? Let me read this again so I make sure that I understand the question.
I think it's the second dose they're asking about. Should they wait after 90 days of if they've received monoclonal antibodies, should they wait 90 days to get their second shot?
Thank you for interpreting. I'm going to have Jim read me every question, guys. Yes. So if you've gotten vaccinated and then you became infected and you got monoclonal antibodies, the recommendation is to wait 90 days before you get that second dose. And so that's a great question. Thank you. And thank you for the clarification.
Thank you, Dr. Byers. Anna Farish from JTV. MEA in Madison is offering monoclonal antibody testing in the form of a shot. Why haven't we been told this was an option? Is there a difference in a shot versus what the hospital is offering? We have mentioned this actually in a previous press conference, and we just mentioned it today. The 4 shots go in the left arm, right arm, and I think left hip and right hip. But Dr. Byers, talk about, are they the same options? I mean, do they both do the same thing? You mentioned one was quicker, of course.
Yeah, you know, this has been available for some weeks now, and we've broadly communicated this with the healthcare community throughout the state. And many of the clinics that are offering and hospitals that are offering monoclonal antibodies have been using the strategy of the injections or the injections under the skin of the monoclonal antibodies. It's still effective. It's an effective treatment. It works just as well as the infusion process for monoclonal antibodies. The difference is it's a little bit quicker, and certainly you can get that treatment done. There's still a wait time that you have to wait in the doctor's office, so there's an observation time after you receive the monoclonal antibodies, whether you receive them from infusion or through subcutaneous injection. But it is a good alternative. And again, many clinics throughout the state are utilizing this in an effort to increase their efficiency and to be able to treat more patients. And so it's available. And like I said, we've widely been communicating this with healthcare providers throughout the state.
Thank you, Dr. Byers. Let's see, we have Nick Juden with the Jackson Free Press. I want to look ahead to the winter. We have short-term contracts for healthcare workers to keep our medical system solvent. If we repeat 2020, a southern spike during the hottest months of the year, followed by a nationwide surge in winter, do we have the ability to maintain the federal support that we need in our hospitals? Are we planning for a winter surge after a summer one? Mr. Craig, why don't you start with that?
Yeah, and I'll let Dr. Byers speak to the surge component of it. But as far as the resources, whether they're federal resources or we'd have to see about bringing in additional contract nursing, I think the stresses on the healthcare system will remain. A lot of hospitals are still short-staffed, especially nursing, but other healthcare professionals as well. I don't know if that will fully resolve, through the winter, but all hospitals I think are doing their best to try to increase staffing and stabilize their staffing bases to be able to continue to support their normal needs as well as their COVID needs. Where there are gaps, we'll continue to try to source those gaps locally, and where we can't, we will reach out for federal assistance.
Thank you. Dr. Byers, did you want to add anything to that?
No, I mean, we are in the middle of this of a summer surge right now. I don't know if we're going to follow the same patterns that we saw last year. I think one of the things that we haven't seen so far with COVID-19 is some level of seasonality. It seems that we are going through these successive waves. Much of it this time has been dependent upon the emergence of the Delta variant, which is very highly infectious, and that's certainly been the main driver of the surge that we're seeing right now. It's hard to know what we may be looking at down the road, but I think the key to this is to make sure that people who are eligible for vaccination get vaccination now. That's going to be one of the things that's going to pay us benefits if we do see some increases in the winter months. Additionally, for those people who are immunocompromised, if it's recommended, get that third dose. And we strongly recommend that now. These are the things that are going to help us down the road to, if we do have the event of an additional surge in winter, we need to be prepared for that now by vaccinating.
Thank you, Dr. Byers. Lena Ferguson is asking, do y'all have an updated number of how many hospitalizations related to the ivermectin have been reported to date? Dr. Byers, do you have that?
I'm still have at this time 2 that have been reported to me that are related to ivermectin toxicity.
All right, thank you. Okay, Margaret with the Sun Herald, what protocols are in place to track people who are violating the isolation orders? Are officials counting on residents to turn people in for violating isolation orders? I answered that to you in an email, Margaret. Maybe you didn't see it, but the main point of this health officer's order, as Dr. Byers said, is reminding people from that pre-existing 2020 November health order that if you are infected, if you test positive for COVID, you are to isolate for 10 days. The rest of the health order is not new. It has appeared on health orders throughout the decades. And we are hoping everyone will pay attention to that and isolate. Dr. Byers, did you want to add anything to that?
No, ma'am, I think we've covered it. Appreciate it.
Thank you. Brenda Craig with WebMD. Have you run into any trouble getting patients to ECMO if they need it? Any shortages of ECMO capability there, Mr. Craig?
So, and we'll see if Dr. Byers is aware of any ECMO shortages being reported. I am not aware of any ECMO being reported as short in Mississippi, but I will say we have a very limited number of facilities that can provide ECMO services. It is, in some cases, an important part of the treatment for a COVID patient, but we're trying to make sure those patients are moved to the facilities where ECMO services are available.
Yeah, thank you. And no, I'm not heard of any shortages either. I mean, this is one of the components of that intensive care that often COVID patients require. And as Mr. Craig said, it's important to get them to the right facility if they need that level of care.
Thank you. Larison with the Daily Beast. In his press conference yesterday, Governor Reeves took pains to point out that not all COVID infections reporting in schools occurred in schools. So especially when we're talking about the increased spread in the younger age groups, how much does in-school spread contribute to this? We've got a lot of 28,000 out on quarantine, you said, Dr. Byers?
Yeah.
Can you take that question?
Yeah, I'd be pleased to. Certainly, we do know that there is transmission that occurs in school settings. It's difficult to know if every one of those cases that are being reported are actually the result of exposures and infections from the school. Remember that we're also seeing high to substantial transmission in all counties, and this is community transmission. And so not only are our children being exposed to potentially COVID within a school setting, they're also being exposed to it from potentially community activities and community spread as well. But certainly there is a possibility that we are seeing transmission that's occurring within the schools. That's why, we encourage schools to do those things, and many of these schools are working very hard to put these in place that we know can limit the transmission in those school settings. And that starts with making sure that they recommend vaccination for all of those eligible students, teachers, and staff. Make sure that they're putting in place a strategy to have universal masking in indoor K-12 settings for all vaccinated and unvaccinated students, teachers, staff, and visitors. And make sure that they're putting in place an asymptomatic screening testing strategy to identify those students and teachers who may not have shown any symptoms yet, but may be infected and may be able to transmit infection, to identify them and exclude them from the school setting before transmission occurs. I think we're still going to be in a rough patch for the next few weeks for schools when we look at the number of children aged 5 to 17 that we're seeing infections in. And I'm encouraged by the fact that we continue to work with schools on a weekly basis, and the schools are reaching out to us. They're asking for guidance, they're asking for recommendations, and we do have a system in place that's able to provide that to the schools.
And following up on that, Nick Juden is asking, how much contact tracing is the department doing in schools right now? Is contact tracing possible with this degree of community spread? Dr. Byers?
Yeah, so we work closely with the schools to provide guidance to them on how to identify those individuals within the school setting who may be exposed. And the schools are the ones that are uniquely placed to identify when there's a case in a teacher or in a student, to identify those students and teachers who may be in close contact that would require quarantine and would have some testing recommendations made. And certainly when we have very high numbers of cases like we do now, that's one of the reasons why it's important for us to say to people who are positive, to remind them through things like health officer orders, that if you're positive, you need to isolate. If you're exposed to a patient, an individual who is positive for COVID, you need to quarantine. These are the ways that we limit the impact of potential transmission in the state. But again, it does become more difficult when we have high numbers of cases to do contact tracing around every one of those individual cases.
Okay, thank you, Dr. Byers. CJ, MSDH said last week 85% of calls regarding livestock ivermectin have been mild cases. Remember, those calls to the poison center accounted for 2%, and of that 2%, 85% of the calls were regarding that. How many calls were made, and does MSDH have any information on counties that had the most calls? Guys, wouldn't this go to poison control?
So,
No, Dr. Byers.
yeah, and certainly, one of the things that we do is we work closely with the Poison Control Center. Guys, it's been a handful of calls. I believe it's been 14 or 15 calls that were reported to me within this last time frame in a week. Now, I don't want y'all to think that that's a small number of calls. We're talking about 14 or 15 people who are calling because they may have toxicity as a result of ingesting livestock ivermectin to self-treat or self-prevent COVID. And so I think the message is if you need information about prevention of COVID, talk to your doctor. The best way to prevent COVID is through the vaccination. If you need information about treatment of COVID, please talk to your doctor. Get access to monoclonal antibodies. Take only those medications that are directed by your physician. Please don't take livestock medication.
Especially when, well, we do have a wonderful vaccine, several that are available. Thank you, Dr. Byers. Let's see, Will Stribling with Mississippi Today. Is MSDH tracking testing and vaccinations for people in prison? Oh, this will come to you, Dr. Byers. If so, what is the current vaccination rate for incarcerated Mississippians? I know we assist the Bureau of Prisons and private prisons. Can you talk a little bit, Dr. Byers, about how we do that?
Well, we assist the Department of Corrections. The Bureau of Prisons is a federal agency, and they work with their federal prison, which is, I believe, the prison in Yazoo County. But we do work closely with the Department of Corrections, and we provide guidance for testing. We help supply those tests in some cases, and certainly we've provided them with vaccine to vaccinate not only their detainees but also the staff in those facilities. Putting your finger on a vaccination rate for incarcerated Mississippians is a little bit more difficult, because remember that incarcerated Mississippians, that is not a static population. It is a population that moves around frequently, and there are a lot of people who are being released with new inmates or detainees that are being incarcerated at times. And certainly, though, we do work closely with the prisons to provide them with testing supplies, testing guidance around cases, as well as encourage them to be vaccine providers and help them with those vaccination strategies.
And Dr. Byers, you said that this is such a fluid population, but would the reporters do well by calling the actual prisons and asking them, since they're administering the vaccine?
Certainly they can. We do ask that the prisons report those vaccinations that they administer to our immunization registry as well. But the prisons themselves and the facilities keep up with their vaccination rates.
Thank you. Let's see, Ross from WAPT. What should schools do for spectators attending high school football games this Friday? And Dr. Byers, the second part of that is some school districts have outside mask mandates for stadiums. Does this make sense? Why don't we start?
Yeah, certainly outside is better, right?
Right.
There's less of a risk of transmission outdoors, and we just encourage everybody to be as safe as they can when going to these outdoor activities. Masks can help, certainly, especially if you talk about those crowded settings where people are lining up to go in to the stadium and lining up very closely to leave the stadium. But I encourage everybody to get vaccinated if you're eligible, to wear a mask in those situations where it's very crowded, even outdoors where you're packed in, and especially if you're not sure that everybody is vaccinated. Certainly that can help with the transmission. But again, outdoors is better, and anything that we can do in an outdoor setting is certainly going to reduce the risk of transmission.
Thank you, Dr. Byers. Blake with the Daily Journal is asking two questions. The first one I'll give to Dr. Byers and the second one to Mr. Jim Craig. Okay, first question to Dr. Byers. The Tupelo Public School District shifted its policy to define an outbreak in large groups as 10% of a group larger than 40 people, rather than following MSDH's policy, which defines an outbreak as 3 or more individuals testing positive in a group within 14 days. What are your thoughts on this approach?
So thank you for that question. And I wasn't sure that that school district had changed the policy. So we appreciate that. We're looking at the possibility of defining a total percent of a group as potentially associated with an outbreak rather than the 3 individuals in a larger group. And so, that may well be a reasonable approach. We're looking at potentially updating our guidelines around that.
Thank you. And Mr. Craig, Baptist Memorial Hospital, North Mississippi in Oxford declared an internal disaster yesterday and said it had requested a 50-bed mobile hospital. Is there any update on this request? Has it been approved? And if so, how soon could it be set up?
Yeah, no, thank you for that question. And similar to the question about DeSoto County and Forest General, there's a lot of hospitals that are, as we've reported, are really feeling the pressure of the increased hospitalizations and the need for additional ICU space, as well as being short-staffed. We did receive information from Lafayette County yesterday requesting us look at a 50-bed hospital deployment to their area. We are in conversations with them to better understand exactly what that might look like and what type of support services they may be able to provide for a field hospital placement. So conversations and discussion continues. But I'll also say that this particular hospital, North Mississippi in Oxford, is one of the hospitals also receiving some additional resources right now. So I think as both Forest General and DeSoto County and now this hospital in Oxford are receiving some of these resources, the ability to open up some of the spaces that they had within their hospital that were unstaffed might help alleviate part of the problem. But again, that's just part of conversations we'll continue to have to support these hospitals as needed.
Thank you. And Nick is asking, to follow up on questions about school reporting, are there any more direct measures MSDH could use to compel schools to be open about their reporting? Does MSDH have the legal authority to demand this information, and will that be used? Dr. Byers, do you want to tackle that?
Yeah, no, I tell you what we're trying to do is we're trying to strongly encourage those schools to report to us. I think it's an important piece of our overall surveillance in Mississippi, and it gives us a real window into what's going on with the schools. We're not enforcing that right now. And what we would encourage the schools to do, though, is to please report. This is a way for not only us, but for everybody else to kind of get an idea of what's occurring in schools.
Thank you.
And one other thing too, I would remind everybody is we had this in place last year too, and we averaged about 850 to 900 plus schools reporting to us on a weekly basis. We're about the same as that now. So the landscape really hasn't changed with school reporting.
Thank you, Dr. Byers. The Clarion Ledger is asking, has there been a spike in COVID testing throughout the state? We've talked about that, Mr. Craig, that we have seen increase in testing. She's asking how big of a spike.
So, we've seen increase requests for testing in a lot of areas of the state. And I think as you saw in the presentation I did today, as we learn of places where people are having to wait 2 or 3 days to be tested, we want to make sure the testing is available. So we've moved pretty rapidly into a lot of areas as we find out that there's additional testing demand. As you can see from the chart this week, though, there were a number of places throughout the state that needed additional testing support that we've responded to. So I don't know if I can quantify other than we had full appointments at many locations that we are operated, and we heard similar reports from a lot of the private and community health centers that are assisting in our testing efforts.
Thank you. And Dr. Byers, this is from the Island Packet, which is in South Carolina, I believe.
Okay.
If they exist, what are the numbers of ivermectin poisonings nationally? We're seeing people recommend ivermectin to others for treatment on Hilton Head. Do you have those, Dr. Byers?
No, I don't have those national numbers. I imagine that there's some the national data related, but you know, there's a couple of things to think about. Someone who has who's obtained ivermectin and is taking it at higher than required or necessary amounts, and I think, you know, these are the things we need to think about, guys. Is don't self-treat with ivermectin. See your provider, talk to your provider, only take medications that your provider prescribed, whether it's ivermectin that you've obtained off the internet or in some other mechanism, or it's ivermectin that you've obtained at a local livestock supply store. Let's don't take that. Let's take those types of medications under the direction of a physician, and only as prescribed by a physician for illnesses that medication actually is designed to treat.
Thank you. And I'm going to take Kobe's question to both of you. Kobe's with MPB, and he's asking, are there any trends being identified about hospitalizations in areas that have high vaccination rates versus areas with low vaccination rates? Dr. Dobbs, do you know anything about this? I mean, Dr. Byers, I'm so sorry.
That's okay. I was going to try to channel Dr. Dobbs. A poor imitation of Dr. Dobbs. In fact, you know, we've been looking at data to try to determine if we are seeing some differences in areas with high vaccination versus lower vaccination rates. What I can tell you, though, is that we've got a lot of transmission in every county. Regardless of the vaccination rate in those counties, we have a lot of transmission, and it's being driven overwhelmingly, guys, by the unvaccinated folks. And when you look at our rates of hospitalizations, deaths, and cases, they're overwhelmingly due to unvaccinated people. But we also have some data on our website that shows the reduction of risk that can occur when you are vaccinated, either through being hospitalized, of dying, or even becoming a case by age groups. And I don't have that on my slide set, but I will add that on there because I think it's important to highlight that we do see a significant risk reduction of being hospitalized, of being a case, of dying if you are vaccinated. And I think that that's going to be the importance that we want to talk about, is for that individual. Your individual risk is reduced.
I mean, I love that bar chart that you show every week, Dr. Byers, because it just illustrates the difference between who gets ill and who doesn't, who's vaccinated and who's not. We definitely see the majority of cases and illness and deaths and those that are unvaccinated. Mr. Craig, do you work with the hospitals? Do you know have anything to add?
Well, the only thing that I'll add, is, you know, Dr. Byers covered it really well, and I do agree that bar chart that shows the vaccination and unvaccinated and the impacts by age group is very informative and should help people in making some good decisions to be protective of themselves and their family. But I will also tell you that when we look at hospitalizations right now, a lot of people think that hospitalization may occur in their local community. No, as tight as our system is right now, we are moving, as I said, lots of folks for critical care services around the state of Mississippi to where a bed's available. So you may not be near your loved ones and other family while you're in that hospital stay. So it's very, very important that we relieve the pressure on the hospital as best we can. I do think that providing the staffing, the governor and MEMA and the staffing package that we have right now going out to these facilities is going to help tremendously. as well as the federal support that we have. But hospitalizations still today are a lot higher than what they need to be for our facilities and the staffing levels that we have.
Thank you. Didn't you say like on Saturday there were absolutely no beds? Did I hear you say that?
Well, effectively, almost every day we have no beds. You think about it, as a bed comes open, there's someone waiting for that bed, a number of people waiting for those beds in other parts of the state that are being bedded in an emergency room or in other locations besides an ICU in a hospital. So moving the person to the next available bed, depending on when you count the beds, as far as how many available may show beds available, but that bed is just waiting for that next patient to arrive.
Thank you, Mr. Craig. We are going to put the slides in the news section where we put the press conference. We'll put the slides up right away so you can use those to inform your reporting. I guess, Mr. Jim Craig, from an operational point of view, the best thing that's happened this week.
Well, the best thing by far is that we've been able to get those 61 task orders into now 61 deployment orders with resources that the governor and NEMA have worked to develop in our state. I can just tell you in conversations that I've had each day for the last 2 or 3 days, as these resources are being prepared to be deployed with hospitals, it's a welcome sigh of relief for many of them and their staff who've been working really, really long and hard and extra shifts and are truly, like many of the public health heroes, these healthcare heroes have been on the job for a long, long time. And I can tell that they're very appreciative that some help is on the way.
Thank you. And Dr. Byers, from an infectious disease state epidemiologist point of view, what's the best thing that happened this week?
I think, you know, with the increasing number of vaccinations that we're administering as a state, I think, you know, the FDA approval of Pfizer for 16 and older is a big step for us to continue our vaccination effort. We've been encouraged with the increased utilization of monoclonal antibodies for treatment for COVID in Mississippi. That's going to be an additional thing that's not only going to help relieve the pressure from the hospitals, but it's going to save lives. And we're still at a point in this surge right now where we're seeing still very high numbers of cases, very high numbers of hospitalizations, high numbers of deaths, ICU utilization, and ventilator use. And I think we need to be thinking about a strategy right now to save lives. And the ways forward for that are vaccination, making sure if you're immunocompromised, get vaccinated, get that third dose, and utilization of monoclonal antibodies if you're infected. We still have a long way to go, but I think that Mississippians recognize where we are and are willing to do what's necessary to get us out of this current wave that we're in.
Thank you. I see that we have no other questions. So on behalf of Mr. Jim Craig and Dr. Paul Byers, I'm Liz Charlotte, wishing you a great afternoon.
Thank you all.